Welcome, and thank you for joining us today. My name is Loretta Besson, and I'm a retirement plan specialist here at Goulden and McCarthy. I would like to welcome you to our Financial Wellness Program series of webinars. I am pleased and excited to be joined today by Jonathan Wilkinson and Stuart Ritter from T. Rowe Price. Just a quick introduction, Jonathan oversees the Metro region as Vice President, Regional Sales Consultant for T. Rowe Price. Jonathan has spent 17 years in the financial industry and focuses on helping advisors add value to their clients' investment strategies, as well as remain informed about trends in the retirement marketplace. We are pleased to have Jonathan with us today, and we also have the pleasure of working with him on a consistent basis. Stuart is the Retirement Insights Leader for T. Rowe Price and has served in a variety of roles related to retirement thought leadership and product development, currently helping the firm's expertise on major topics that impact the retirement industry. Stuart is also a frequent speaker at client and industry events as a retirement subject matter expert and serves as one of the firm's spokespersons to national media organizations. We are really excited to be joined today by these experts who will cover the presentation on healthcare costs in retirement. I have had the pleasure of listening to this presentation, and I think you will be pleased with the information shared today. Our goal for today is to help provide an understanding as to what really happens with healthcare costs in retirement and how it can be addressed as part of overall retirement planning. As a reminder, our team at Goulden & McCarthy is available to help answer any questions you may have regarding this presentation or your financial plan more broadly. And I will provide our contact information again following this presentation. And without further ado, I will turn it over to Jonathan.
Thank you, Loretta. Good morning, everyone. My name is Jonathan Wilkinson. I am with T. Rowe Price, and thank you for that for the introduction, Loretta. A little bit more about who we are as an organization. T. Rowe Price is an investment management firm. We manage a little over $1 trillion in assets. The majority of these assets are in institutional accounts, such as retirement plans, as the one that you're in with Goulden McCarthy. And so we take pride in a lot of the efforts that we make are really geared towards having a long-term time horizon, focusing on challenges and issues that participants and employees face when it comes to saving for retirement. So part of what we do is investment management. That is the core focus of our firm. But along with that is we try to look into areas of the industry, look into challenges that are facing participants when it comes to saving money for retirement. And a big part of saving for retirement is healthcare, right? We've been hearing research from folks. You may see ads on TV or when we used to go to conferences talking about how much money and how expensive healthcare is going to cost us in retirement. And the resources that we have, and I'm proud to bring on Stuart Ritter, who you heard a little bit about his background as a CFP, been with T. Rowe, call it 20 years. Was an adjunct faculty member at Johns Hopkins. So in his DNA is both financial planning and education. So I think you're all in for a treat today, where we're going to learn a little bit more about some of the research that we've done on the healthcare costs. And we have a presentation called "Healthcare Not a Six-Figure Word," because we did a lot of research, and I think you'll find some surprises, good surprises, hopefully. That it's not necessarily, you're going to hear this phrase a lot from Stuart, the big scary number, right? We all hear it's going to cost you $100,000, $200,000, $500,000 in retirement. It's just a very daunting number to hear. So we're going to go into that a little bit further. Stuart's going to spend a lot of time talking about what healthcare costs look like in retirement, not only from a total sum of what we think we're gonna have to pay, but sort of the cadence. What do the payments look like? Is it one big lump sum? Is it the same amount every year? Is it all at the end? Is it all in the middle? What have you? So I think by the end of this presentation, you're going to have a much clearer understanding of what that potentially could look like. So I wanted to just give a brief intro of what we're going to be discussing today, and now I will turn it over to Stuart. As a reminder, if there are any questions about today's content, please reach out to Loretta at Goulden & McCarthy, and she can give you more information on the content, and we're happy to circle back and follow up with any questions you may have. So without any further ado, I will turn it over to Stuart Ritter. Thank you, Stuart.
Super. Thanks, Jonathan. Thank you, Loretta. I appreciate the opportunity to join you, and thanks for the kind words about the presentation that you saw. And for all of you who are joining, thank you for some time to share, as Jonathan pointed out, some potentially surprising information about healthcare costs in retirement, because we do hear that they're an enormous sum. And this presentation is designed around the fact that healthcare does not have to be a six-figure word, something that we avoid talking about, something that is separate from all the other retirement planning that we're doing. Rather, it's incorporated into the holistic retirement planning that we're doing. And I want to spend some time helping you understand why that is. So let's look at three things as part of this presentation. We're going to look at what people are hearing, the kinds of things that you are seeing in the headlines, and then we'll look at what's really going on. That's where we'll spend the bulk of this presentation, so that you come out of the session with a better understanding of what's really going on with healthcare costs in retirement. And third, once you actually understand what's happening, what are some things you can do about it? So let's start with what people are hearing. And what people are hearing is that the costs are huge. When you read the headlines and see some of the estimates that are thrown out there for what a retiree will have to pay the day they retire as a lump sum, here are a couple of the numbers: $311,000, $325,000, almost $400,000 is put out there, and people think of as the check that they need to write the day they retire to pay for their healthcare costs in retirement. And not surprisingly, as a result of thinking that the numbers are so high, people are really, really worried about healthcare costs in retirement. Two of the top three retiree spending concerns are the two components of healthcare costs: healthcare insurance premiums and out-of-pocket costs. So we're hearing about big numbers. We're fearing what that means for us. And because it's represented as a big, scary number, we end up with some problems when we're thinking about healthcare costs in retirement. First of all, that big, scary number representation is misleading. It doesn't give you an accurate picture of when you'll be incurring these costs and what those costs might be. And because it's represented as a big, scary number, it's overwhelming. I mean, people look at that kind of number, $400,000, and they compare it to what's in their 401k plan and go, I don't think I'm ever going to be able to retire. And that lets people feel that it's just unmanageable. There's nothing I can do about this. It's a six-figure word. I'm not going to talk about it. And people don't know where to go. It limits the solutions that we all think about, you as individuals and us as professionals. You know, what can we do if somebody has to write a big check the day they retire? It's really hard to build a financial plan around that if that's what people think is what's happening with healthcare costs in retirement. And more importantly, it skews our perception of the risks that we face. And it does it in two ways. First of all, it leads to people thinking that everyone is going to have to pay this big lump sum the day they retire. And second, people do what I alluded to earlier. They look at that big giant number, they look at the balance in their 401k plan and simply compare those. And what's missing from that comparison is any future growth on what might be in their 401k plan and any income they might be getting from Social Security. People just start comparing balances, and that's not the way spending actually happens in retirement. Now, fortunately, it's not a big, scary number. I wouldn't be doing this presentation if all I was doing was having a slide with a big number on it and then saying, okay, that's it. I'm going to give you three reasons why it's not a big, scary number, so that you understand why what you're seeing in the headlines is not actually what a typical retiree experiences. And then we'll talk about what actually is going on, so you're in a better position to make some decisions today to be prepared for what might actually happen. So three reasons why it's not a big, scary number. Reason number one, it's not a lump sum. You don't hit retirement and have somebody knock on your front door and say, okay, pay all of your retirement expenses today. No one shows up and says, you've got to pay for all of your internet or cable expenses today. Give us $86,000. if you look at a $150 monthly internet cable bill and extend that over 30 years, it works out to about $86,000 today. I can make any ongoing monthly payment sound big if I make it today's lump sum, but that's not how you pay your internet or cable bill. You don't pay it all at one lump sum 30 years ahead of time. You pay it as a monthly expense ongoing. And that's the same thing that happens with healthcare costs. You don't pay it all up front. And that's what makes it look like a big, scary number. You pay it every year, every month for the premiums. The Medicare premiums are taken out of your Social Security check. So that's a monthly cost. And then you would have out-of-pocket costs, and we'll get into what those might be, but those also you pay as you incur the expense. So the first reason it's not a big, scary number is because you don't pay it as a lump sum. The second reason it's not a big, scary number is that you is not we. Those numbers you see are almost always for a couple. It's for two people. Even though a lot of people internalize it as being just for themselves, it represents the cost of two people and almost essentially doubles what an individual might pay. But again, not as a lump sum, which is the first reason it's not a big, scary number. And the third reason it's not a big, scary number is that those numbers you see out there are not even remotely average. They are not what the typical retiree is experiencing. It's almost like the weather forecasters competing with each other to see who can come up with the biggest number. Because, you know, if I predict we might get an inch or two of snow, I'm going to get 12 seconds of airtime. But if I talk about the 3-foot storm of the century we're going to have happen, I'll get a lot more attention. And sometimes people are trying to come up with a bigger number potentially to get attention, not to give you an understanding of what the typical retiree's experience is. For example, one of those numbers I showed earlier, the way they get to that number is they take the medical costs that are higher than 90% of all other retirees, and they take the prescription drug costs that are higher than what 90% of retirees pay, and they add those two numbers together, even though it's not the same person, and say, oh, here's your big, scary number. Picking a number that 9 out of 10 retirees don't pay is not showing what the typical retiree pays. So those are the three reasons it's not a big, scary number. Now, I know what you're thinking at this point. Okay, if it's not a big, scary number, what is it? And that's what we'll delve into. We're going to talk about what really goes on with what people spend for healthcare costs in retirement. And we'll look at 3 areas. We're going to look at what retirees spend on healthcare costs compared to what they spend on everything else. We'll look at fixed expenses, and we'll look at variable expenses. So let's take healthcare versus everything else. Bureau of Labor Statistics puts out a study every 2 years where they look at a very detailed spending analysis of what retirees and people of all ages spend, everything from how much you spend on dairy products to motor oil for your car. And they put the spending into categories. So what I want to show you here is the #1 spending category. And I've even taken early retirees out of this analysis. This is for Americans over age 75. And about 1/3 of what they spend goes to this one category. What is it? Did you say healthcare? Of course, it's got to be healthcare. It's not. Surprised? I was. The #1 spending category for people over age 75 is actually housing. As a matter of fact, housing is the #1 spending category for every age group. Now, healthcare gets a lot of attention. It's in the headlines a lot. But in reality, for the average retiree, and here it's for people over age 75 specifically, later retirees, the #1 category of spending is housing. All right, let's look at categories #2 and 3, 16% and 13% respectively. Take a minute and think about what those might be. All right, do you have an idea? Did you say healthcare? Maybe you did, but perhaps with not quite as much confidence as the first time around. And You got some ideas for that third one? So healthcare is the second biggest category, and food is the third biggest spending category for Americans over age 75 plus. And that last slice of the pie is probably everything else you thought of: transportation, entertainment, things like that. So let me make two observations when we look at where people spend their money when they're over age 75 plus. First of all, healthcare is not the #1 spending category. It's #2 by less than half of what #1 is. And it's on the same order of spending as food. And we don't hear a lot of people worrying about food. Now, there are some people who are worried about how much they need to spend on food, but it's generally not something that's treated as a separate category that we can't talk about because it's going to be so high. The takeaway from this slide is that healthcare fits in with all the other things we spend money on: housing, transportation, entertainment, food, clothing, all of those things. It's part of the same retirement planning that we do when we get there, and the reason to save today for retirement. And just a quick note, some of my panelists, I think we may be off mute. If you wouldn't mind putting yourself on mute, that would help a little bit, please. Thanks. All right, so this is what people over age 75 plus spend on housing compared to healthcare, compared to food, and so forth. Now, one of the other things we hear about spending on healthcare is that as people get older, they spend more on healthcare. So let's take a quick look at that. I'm going to bring our 65 to 74-year-olds back in the picture here, use these four main categories, and compare the spending for that age band to the spending for the 75 plus age band. And what we see is that spending on healthcare does indeed increase when you look at the 65 to 74-year-olds compared to the 75 plus. But when you look at spending on the other categories, that spending decreases. Now, I was surprised by this because what it means is it's not as if people's spending is steady throughout retirement and healthcare costs just keep increasing and piling on top of that spending. What it says is spending in other categories decreases, and decreases by more than the spending for the average retiree on healthcare increases, so that people's overall spending goes down. The increase in spending on healthcare is made up for by the decrease in spending elsewhere. And when you think about this, it generally happens organically. As people get older, as they have more healthcare issues and their spending on healthcare goes up, well, then they're traveling less. Maybe they're going out to eat a little bit less. They slow down. So spending in the other categories decreases. So it's not as if healthcare piles on to everything else. As it goes up, spending on other categories decreases by more than the increase in the healthcare spending. So that's what people look at when it comes to their spending. For the next section in this presentation, I want to use a deck of cards to talk about probability. You see the deck of cards laid out in front of you. You've got the four suits there. And if I wanted to draw a line where half the cards were to the left of that line and half the cards were to the right, I draw the line at the king of clubs. For those of you who were paying attention in 8th grade statistics class, that would be called the 50th percentile, or the median, the point at which half the cards are to the left and half the cards are to the right. If I wanted to draw a line where 95% of the cards, 95% were to the left of that line, I'd draw that line at the Queen of Hearts. Now, I'm rounding off a little bit. This is to illustrate the idea, but you get the concept. At the 50th percentile, half the cards are to the left. At the 95th percentile, half the cards, 95% of the cards are to the left. Now, I want to apply this to healthcare spending in retirement. So I'm looking at, on the next slide, all retirees and total healthcare spending each year. So every year, think about how much retirees spend for their total healthcare costs, so both premiums and out-of-pocket expenses. And I want you to think about what dollar amount is at that 50th percentile. If I were to lay out, like the deck of cards, the spectrum of expenses for all retirees, from the person who spends the least to the person who spends the most, what is the dollar amount where half of retirees spend that dollar amount or less each year for their total annual healthcare spending? It's $3,400, not $400,000, $3,400. Half of retirees spend that amount or less for their annual total healthcare spending. Surprised? I was. That's what, the third time I've said that? There's a lot in here that may be surprising because the only message we generally hear about healthcare costs is that big scary number. And yet, when you look at the actual data, half of retirees spend $3,400 or more. It's as if a retiree shuffled a deck each year, pulled out a random card, and anytime they got a black card, they paid $3,400 or less. Now, I recognize that even if we are surprised at how modest that number generally is, we're worried actually about pulling that Queen of Hearts or the King of Hearts. So the dollar amount where it's higher than what 95% of all other retirees spend each year for their total healthcare spending, well, that number is $10,100. Still not a six-figure number. So if I'm shuffling the deck and pulling a number out, pulling a card out, if I get a black card, it's $3,400 or less. If I get any red card other than the King or Queen of Hearts, I'm paying somewhere between $3,400 and $10,100. And if I get the Queen or King of Hearts, I'm paying $10,100 or more. This is how retirees actually experience healthcare costs in retirement. And that analogy of shuffling the deck each year and pulling a random card, that fits pretty much for everybody. There's 5% of retirees, if they have an increase in expenses of $2,000 that lasts for more than 4 years, that'll persist. But for everybody else, if I happen to pull a red card one year, that's usually a one-time expense, and then I'm pulling a random card again after that. If I get my hip replaced one year and my healthcare expenses go up, I don't get my hip replaced the next year as well. So I've got a 50-50 shot of that $3,400 number or less each year. So let's break it down. Yes, ma'am. Go ahead.
I just have a quick question on that, which very interesting information. Is that inclusive of premiums as well, or you're talking about out-of-pocket expenses
So
other than the premiums?
It includes premiums. So that's total annual healthcare spending. That is Medicare premiums plus out-of-pocket costs each year across all retirees.
Great, thank you for that. Thank you for that clarification.
And thank you for the opportunity to bring in something I usually mention a little bit later, but I'll mention now because I know it's on the minds of some of the folks who are watching this, which is, does it include long-term care expenses? And the answer is yes. These numbers include long-term care expenses. And I'll get into some more details about that as well. But this includes both healthcare spending, medical spending, as well as long-term care. So thank you for the opportunity to drop that in at this point. So
Perfect.
Let's break it down. I mean, you're bringing up the two important components of it, fixed expenses and variable expenses. So we're going to look at each one in turn. So we're looking now at fixed expenses. And one of the things that may surprise you is that 3 out of every $4 that retirees spend for healthcare is for fixed expenses. It's essentially Medicare premiums. And the advantage of spending most of your healthcare dollars on fixed expenses is that they're fairly knowable, budgetable, pay for them out of ongoing cash flow. Medicare premiums generally go up each year, but we know what they're going to be. It's fairly stable. And that allows us, as I mentioned earlier, to incorporate it into the overall retirement spending that we're doing and incorporate it into the retirement saving that we're doing today in preparation for retirement, because it's the bulk of what people spend on healthcare expenses, and we kind of know it in advance. So it's not as if what people are spending is primarily out-of-pocket costs. Most of what people spend for their healthcare expenses in retirement is made up of fixed expenses. So now let's get into the part I know folks have been waiting for, which is those variable expenses. Okay, I'll pay my Medicare premiums, but I'm worried about those out-of-pocket costs. So we're going to look at it from two perspectives. The first is annually, what are people paying for their out-of-pocket expenses? And then second, we're going to look specifically at end-of-life costs. And the reason we're doing that is twofold. Number one, end of life tends to be the most expensive part of someone's life when it comes to healthcare costs. And second, for end of life, we're going to look at the last 2 years combined. So the first part of this section is just by year, annual. End of life is going to be there because it's most expensive, and we're combining the last 2 years of life. So let's look at annual expenses. Now I'm going to break this down by age band, and I'm going to go back to my deck of cards to help us understand it. So same thing here. We're going to look at the median. We're going to look at the number at which, for people in their 60s and 70s, out of pocket annual variable costs, the dollar amount at which people, half of retirees are paying that amount or less, and half are paying more. Now remember, I'm taking Medicare premiums, setting those aside. This is just what people are actually writing a separate check for each year. For folks in their 60s and 70s, their annual variable costs are $1,000, not a six-figure number. When people are in their 80s, people in their 80s are paying $1,000. Half of retirees in their 80s pay $1,000 or less for their annual variable costs. When people are in their early 90s, that number is $1,000. And in their late 90s, it's $1,000. Now, again, I know at this point, we're not worried so much about what's going on at the median. What if I get a black card? We're worried about what if I get the King or Queen of Hearts? What if I end up with an annual variable expense that's higher than what 95% of all the other retirees in my age band are paying? So let's go back to the 60s and 70s and look at that number. For people in their 60s and 70s, if someone has an expense that's higher than what 95% of all other retirees at that age are paying, it's $7,000. That's their annual variable cost. In their 80s, it's $13,000. Early 90s, it's $33,000. And late 90s, it's $42,000. Now, I just threw a whole bunch of numbers out there, so let me put them all into a table so you can see it in one place. And let me make two important observations about the numbers that you see on this table. My first observation would be that the amount people pay at the median, what half of retirees pay, is a modest amount, and it does not increase as people get older. Folks in their 90s, their late 90s, are paying the same at the median for their annual variable costs as people in their 60s and 70s. It's a modest amount, and it doesn't increase when you go up these age bands. The second observation I'd make is those big numbers we're worried about are out there. They do exist. This presentation is not to claim that people don't pay a lot of money for their healthcare expenses. There are people out there that do. What I hope you're taking away from the presentation, though, is that it's not everybody. It's not guaranteed. It's not happening at age 65. It's only when two things occur that we see these big numbers. First of all, someone has to incur an expense that's higher than what 95% of all the other retirees at that age are experiencing. So let's take that $42,000, for example. It's only someone in their late 90s who's having an expense that's higher than the expense out of pocket each year that someone, that 95% of other retirees are experiencing. The other thing to remember is somebody has to live to their late 90s in the first place. So if we take the typical 65-year-old, so if I'm talking to a 65-year-old and we're discussing the chances of that person experiencing the $42,000. So first of all, they have to have an expense in their late 90s that's higher than what 95% of the other late 90-year-olds experience. And second, that 65-year-old has to live to their late 90s. If they're male, that's a 1 in 4 chance. If they're female, that's a 1 in 3 chance. Now, I'm going to combine and simplify some things here, but let's go back to our deck of cards. It's as if that 65-year-old is sitting in front of 2 decks of cards, and we shuffle both decks of cards together, and they only experience that $42,000 number if they pull out just the King of Hearts with the red back. from that 2-deck of cards shuffle. So the number is out there, and it's important for people to recognize that. At the same time, understanding the likelihood of that happening and who it happens to helps us get a better handle on how retirees actually experience healthcare costs. So that's annual variable costs. As I said, we'll also look at end-of-life costs. So last 2 years of life, and again, this is just the variable cost. So Medicare premiums are still set aside. We're looking at what might come out of someone's pocket. So I'm summarizing here. I'm doing the age bands right up front. $30,000, $4,000, $5,000. Again, this is the most expensive part of someone's life where they're spending on healthcare costs, and at the median, half of retirees are still paying a fairly modest dollar amount over the last 2 years of life, and it doesn't increase all that much as people age. Now, if someone does pull the King or Queen of Hearts, now we're seeing a 6-figure number, $114,000. That is a 6-figure number. And it's made up primarily of long-term care costs. So if someone has an expense that's higher than what 95% of other people in their 90s are experiencing, and they're in their late 90s, especially, they will have those bigger numbers. If they get any other red card other than the King or Queen of Hearts, they're paying something between those dollar amounts that you see on your screen. Now let me pause, because I know what you're thinking. Every one of us can think of somebody who is paying a pretty big amount of money, probably because they're in a long-term care facility. We can all think of somebody. At the same time, it's important to remember that sometimes that exception proves the rule. We can all probably think of someone who is paying that high dollar amount, those 6-figure numbers. At the same time, if I asked you to give me the names of 5 people or 20 people, we'd be hard pressed to do that of the literally millions of retirees that are in these age groups. So while we can think of somebody, it's important to recognize, as this card analogy is showing from the data we've analyzed, the likelihood of experiencing that dollar amount, and then the likelihood of experiencing these other dollar amounts. Any black card, I pay that median amount or less. I want to look at this from one other perspective, and that's by gender. So we've looked at age bands up until this point. Now we're looking at gender, and you see the same pattern happening. Male or female, the dollar amounts are very similar, even across age bands, when we're looking at the median. At the 95th percentile, now we start seeing some differences between what males and females pay if they have an expense that's higher than what 95% of retirees are experiencing at that age band, and especially a difference for folks in their 90s. So bear this in mind as you're thinking about who and when people are experiencing these higher dollar amounts. Lastly, let's look at whether healthcare will use up all of someone's money. So what we're doing in this section is we took those dollar amounts you just saw, and we're dividing it by a household's net worth, which we're defining as their assets plus their home equity minus their debts, or their home value minus their debts. So this gives you a sense of how much of a household's net worth will be used up by healthcare spending. And the reason this is important is because if folks have somebody else, a spouse or significant other, that they're worried about having enough money after they pass away, or want to leave money to somebody else, getting a sense of how much healthcare costs can use up. And this is, again, at end of life. So the most expensive part, last 2 years. And it's the same pattern. Low single digit percentages of spending of the household net worth for folks at the median. It's when someone has an expense that's higher than 95% of what everybody else at that age is experiencing that we see bigger percentages. 40% of the net worth for folks in their 60s, 70s, 60% in their 80s. And the reason it's 135% is because someone has experienced an end-of-life cost that's actually higher than the asset level that they have. Now, let me make one final comment in this section so that you understand these numbers specifically. Because it's long-term care spending that uses up that big amount of money, what we've done is we've actually removed people on Medicaid from this analysis. As we know, people who qualify for Medicaid, the state is paying for their long-term care expenses. So their out-of-pocket costs for their long-term care expenses are zero. And putting a bunch of zeros in this analysis would be misleading. So we took all of those people out. The folks you're seeing at the 135%, those are people who tend to be just above the Medicaid cutoff. So they're folks of fairly modest means, fairly low net worths, just not low enough to qualify for Medicaid. They're just above that level. And then, of course, as people's net worth increases, the percentage of that net worth that is used up by those dollar amounts goes down. So I just want to give you some background on where that 135% is coming from and who actually experiences that. All right, let me sum up what I've talked about in this section about what's really going on with healthcare spending in retirement. First of all, it is not a big scary number. It's not $400,000 that people have to pay the day they retire. It's not even the largest retirement expense. Housing is number one. Healthcare is number two by less than half, and about what the average retiree spends on food. It's an annual expense and mostly fixed. And for half of people at least, it's a modest amount for those variable out-of-pocket expenses. Now, the big dollar amounts do exist. They tend to exist, though, for a very small percentage of people. Only somebody who pulls a king or queen of hearts out of our deck of cards. They have an expense that's higher than 95% of what everyone else is experiencing. And generally, only for people who live to their late 90s. So longevity is another element to consider as we're thinking about what really goes on with retiree healthcare costs, when it happens, and who experiences it. Which brings us to our third section, what do I do about it? Now that I better understand the problem I'm trying to solve, how do I think about it today and the kinds of things that I might be doing in order to position myself to be prepared for these expenses in retirement? So we need to understand the situation. We spent our time talking about the costs. The other thing to understand is you, the person. First of all, who might be on your wellness team? Are there family or friends who could help if you have a healthcare expense? If there are, then especially at end of life, that may reduce the costs you pay. And if not, that's something to consider in terms of how much you might spend. Another thing to consider is an advance directive, which indicates what resources and efforts you want to have put in at the end of life. Depending upon what that is, that has an effect on how much you might pay. And then think about your personal circumstances, everything from your risk tolerance to how you feel about insurance and paying for a higher premium for insurance and not having to worry so much about variable costs. All of that gives you a better sense of who you are and where you are in terms of your ability to fund and think about healthcare costs in retirement. The other thing to then consider is three kinds of solutions. There are three areas I want to briefly mention: funding, investments, and insurance. Funding doesn't just refer to how much money have you saved, the 15% to be saving towards retirement, but it also refers to what account you are saving in. So if all your money is in a traditional pre-tax account and you have one of those years where you pull a red card and have a higher expense and therefore need to pull more money out of a pre-tax account and include it in your taxable income, depending upon how much that might be, it might increase your tax bracket in retirement, subject more of your Social Security to taxes, maybe even increase your Medicare premiums. On the other hand, if you have a Roth account, if you have a health savings account, an HSA, where you can make qualified withdrawals that are not taxed and avoid some of those consequences, that gives you a little more flexibility to pay for healthcare costs in retirement. So traditional, Roth, HSA, the folks at Goulden & McCarthy can help you think that part through. Think about the investments you might need. If I might need a larger pool of assets when I get older, more money because I might have one of those red cards, do I have investments and am I taking advantage of them that provide enough potential growth in order to give me those increases in assets that I might need? And lastly, insurance. What Medicare, Medigap insurance policies might I consider? What features do I want? Do I want to think about long-term care insurance? How does that fit in? So thinking about funding, the accounts that are available, how you're investing your money, and what insurance solutions are available can help you start matching what you're doing today to what you want to think about in terms of how you're going to handle healthcare costs in retirement. And your employer's plan plays an important role in this. If you have a financial wellness program that you can take advantage of, that helps you with some of the budgeting, that helps you build emergency funds, that can be important. We at T. Rowe Price have a visualized retirement program that can help you think more critically about what your vision for retirement is, about what you want to do and who you want to spend your time with in retirement, which includes thinking about who might be on your wellness team. And then what withdrawal options does your retirement plan have? Is there a systematic withdrawal option to help you manage those ongoing monthly expenses? Is there an ad hoc withdrawal option that can help you with a red card, spiky healthcare expense? And again, what accounts are available? What investment options do you have? Are you taking advantage of them in the best way for your situation in order to be prepared for healthcare costs in retirement? And again, the folks at Goulden & McCarthy can help you with any questions you might have about that. In sum, healthcare is not a six-figure word. It's not something we should avoid talking about and treat healthcare as a separate topic. It integrates with all the other retirement saving and spending decisions that we're making. It's not a one-time decision. It's something we deal with on an ongoing basis as we do with all our other expenses. You're in a position to reevaluate and adapt every year. And what I hope this presentation has done is put you in a better position to understand how healthcare costs actually show up for retirees and allow you to feel more confident about what you're doing today to prepare for them, no matter what may be in the cards for us. So thank you very much for your time and your confidence in T. Rowe Price. And Loretta, I appreciate the opportunity to share this information.
Stuart, thank you so much. I cannot express how this presentation has such great content in it, so much good information. Hearing it twice on my end, just kind of walking away with that. Obviously, it's not a big scary number, and we certainly will. That information will resonate with folks. It's thinking about those averages. It's looking at really the fact that it's not a lump sum. We obviously need to take that into consideration as part of our overall retirement planning. As you said, our team at Goulden & McCarthy is available to the plan participants. So if you guys have any follow-up questions on this content, please listen to this presentation. Again, our content is recorded and will be available out on our financial wellness portal. I want to thank both Stuart and Jonathan for taking the time this afternoon to deliver this information. And with that, I hope you all have a wonderful day. Thank you so much. Take care.